Hello and welcome to the Emergency Room Podcast, the place where we delve into the fast-paced, life-saving world of emergency medicine. Are you ready to explore the critical decisions and cutting-edge treatments that happen daily in the ER?
Hey everybody, and welcome back for another deep dive with us. You know I love diving into the research you send, and today we're going to be talking about pneumonia.
Okay.
Specifically, we're looking at some stuff about this less common type called cryptogenic organizing pneumonia, or COP.
Okay.
And then we're going to look at some new European guidelines for how to treat severe cases of pneumonia that you get out in the community.
Right.
So two very different but very interesting topics, I think. But let's start with that cryptogenic organizing pneumonia. Just the name COP. I'm already...
Mouthful.
Yeah, it makes me think of some kind of like sci-fi movie or something.
Right.
What exactly is it?
So organizing pneumonia refers to a pattern of inflammation and repair that happens in the lungs. And so, you know those tiny little air sacs in your lungs that help you to breathe?
Mm-hmm.
Imagine those filling up with like fibrous tissue, almost like scar tissue.
Oh, wow.
And that's what happens with COP.
Okay.
And it makes it really hard to breathe. The cryptogenic part just means we don't know what causes it.
Oh, so it's like a mystery.
Exactly.
It's like your body's trying to heal itself, but it's kind of going overboard.
It's a repair process gone wrong.
Interesting.
And what's also interesting is that it used to be called bronchiolitis obliterans, organizing pneumonia, or BOP.
O-P. Ooh-P.
That's a much more fun name.
Catchier.
Yeah.
But doctors realized that it was primarily affecting the air sacs, not those tiny airways.
Okay.
So they changed the name to be more accurate.
It makes sense.
Yeah.
Now, you said it's less common.
Yeah.
How often does it actually occur?
Well, it's hard to say exactly how often it occurs, but it seems to be less common than initially thought.
Okay.
And it usually shows up in adults in their 50s and 60s. It affects both smokers and non-smokers.
So you can't really avoid it?
Right, necessarily. It's not directly linked to any particular lifestyle.
Okay, so what are the symptoms? Is it like regular pneumonia where you have a fever and cough?
It can be, but not always.
Mm-hmm.
The symptoms often develop gradually over weeks or months.
You might have a dry cough that just won't go away, shortness of breath, especially when you're exerting yourself, and sometimes flu-like symptoms.
So it could be mistaken for a lot of other things.
Absolutely.
So how do you diagnose it?
So doctors will consider the patient's symptoms, their medical history, and use imaging tools like chest x-rays and CT scans.
Okay.
Those can reveal the patchy areas in the lungs that are characteristic of COP.
Oh.
They might also analyze fluid from the lungs to rule out other conditions, and if things are still unclear, they might do a lung biopsy to get a definitive diagnosis.
So you really have to look for it.
Yeah.
Now, we're talking about cryptogenic organizing pneumonia where the cause is unknown.
Right.
But are there other types of organizing pneumonia where we do know the cause?
Yeah, there are definitely other types that can be triggered by infections, certain medications, or autoimmune diseases.
Oh, okay.
But today we're focusing on the mysterious one.
Okay, so let's say you get a diagnosis of COP.
Mm-hmm.
What happens next?
Well, the good news is that most people with COP respond very well to treatment with glucocorticoids, which are steroids.
Okay.
Prednisone is the typical medication, and it often provides relief within days.
Oh, wow.
So it can be very effective.
So steroids get a bad rap, but they can be really helpful.
They definitely can, but it's important to use them carefully.
Oh, yeah, of course.
Stopping steroids suddenly can lead to a relapse, so the dose has to be tapered down gradually.
So it's a process.
It is.
What about if steroids aren't working or someone can't take them? Are there other options?
There are some other options. Macrolide antibiotics, like erythromycin, have shown some promise in treating COP.
Okay.
It seems they have anti-inflammatory effects in addition to their antibiotic properties.
Interesting.
But they might not be as effective as steroids,
Gotcha.
so usually considered a second-line option.
Okay, so what's the long-term outlook for someone with COP?
So the prognosis is generally very good with treatment.
That's great.
Most people recover fully.
Wow, that's really good to hear.
However, there are a few variations of COP that can be a bit more challenging to treat.
Oh, okay.
Like there's one called cicatricial COP, which tends to cause more lung scarring.
Oh, so more permanent damage.
Right, and very rarely COP can lead to more serious complications.
So it's still important to be aware of it and get treatment.
Definitely.
Anything else people should be aware of?
I think one of the most important things is awareness.
Yeah.
COP can be misdiagnosed because the symptoms can be similar to other conditions.
Okay.
So if you have unexplained lung symptoms that just aren't going away, especially a cough or shortness of breath, you should talk to your doctor about the possibility of COP.
That's great advice.
Yeah.
Well, let's move on to the European guidelines for severe pneumonia.
Okay.
I'm curious to hear what they have to say.
Yeah, me too.
So these European guidelines are all about severe pneumonia,
Right.
the kind that can land you in the ICU.
Yes.
Why new guidelines? Was there something specific that needed updating?
Well, severe pneumonia, especially the kind you pick up out in the community, it's still a big deal.
Right.
A lot of people, unfortunately, don't survive it.
Oh, wow.
And these guidelines aim to improve those outcomes and promote the best ways to treat it.
That makes sense. So what are some of the big changes in these guidelines?
One of the most exciting things is the focus on rapid diagnostic techniques, RDTs.
Okay.
It used to be we had to wait for cultures to grow to know what was causing the pneumonia,
Yeah.
which could take days.
Oh, wow.
But now we have tests that can identify the bacteria or virus in a matter of hours.
That's incredible. That must make a huge difference
It does.
for treatment.
Huge difference.
So what kind of RDTs are we talking about?
So one they talk about is multiplex PCR.
Okay.
It's like having a detective who can identify the criminal and tell you their whole backstory.
Oh, wow.
It can tell you the specific bacteria or virus.
Yeah.
And even spot those antibiotic resistance genes.
So it can tell you if the bacteria are going to be tough to kill.
Exactly. Which is crucial for what we call antibiotic stewardship.
Okay, I've heard of that. So making sure we're using antibiotics wisely.
Exactly. Only when we really need them.
Yeah.
So we don't make that resistance problem worse.
It sounds like these RDTs could be a game changer for that.
Yeah, they really could.
Any other RDTs besides this multiplex PCR?
There's another one called MelDetough MS.
Okay.
And this one analyzes the proteins of the microbes to pinpoint the culprit.
So it's like taking their fingerprints.
Yeah, exactly.
I love that.
Now, what about those pneumonias caused by those bacteria that are resistant to multiple drugs?
Yeah.
The MDR infections.
Right, those are the scary ones.
Those are the tricky ones.
What do the guidelines say about those?
Well, they stress the importance of assessing the patient's risk for MDR early on. So doctors can use risk factors and even scoring systems to figure out who's more likely to have one.
So it's not one size fits all.
Not at all.
You really have to tailor the approach
Definitely.
to the patient.
Right.
So if someone's high risk, then what?
They might start with broader spectrum antibiotics
Okay.
that can kill a wider range of bacteria, but you don't want to overuse them.
Right, because then they'll become resistant.
Exactly.
It's a tough balance.
It is a tough balance.
Now, the guidelines also talk about this procalcitonin, or PCT,
Yeah.
which is a biomarker in your blood.
Right.
So PCT can help doctors decide if antibiotics are even needed.
It can. A high PCT level suggests the infection is bacterial
Okay.
and likely needs antibiotics.
Gotcha.
It can also help guide decisions on how long to give antibiotics.
Oh, that's interesting. So you might not need them as long as we used to think.
You might not. And shorter courses can help reduce side effects
Yeah.
and prevent disruptions to the microbiome.
That's a good point. So using them smarter, basically.
Exactly.
Now, another thing the guidelines address is managing respiratory failure,
Right.
which I imagine can happen pretty quickly with severe pneumonia.
It can?
What are some of the things they can do for someone having trouble breathing?
Well, high-flow nasal oxygen, HFNO, is often the first line of defense.
Okay.
It's a more gentle way to deliver oxygen than a mask or a ventilator.
So it's less intimidating.
Exact for
Right.
the patient. Yeah, but if HFNO isn't enough, they might have to move to non-invasive ventilation, NIV, which uses a mask to help the lungs inflate.
So there are some steps before you have to go to a ventilator.
Right, several options.
Okay, so we've talked about diagnosis, assessing risk, biomarkers, managing breathing difficulties. What about the antibiotics themselves? Any new recommendations about which ones are best for severe pneumonia?
Well, beta-lactam antibiotics are still considered the go-to.
Okay.
They work against a wide range of bacteria,
Mm-hmm.
but sometimes they need a little help.
Like a sidekick.
Exactly. And the guidelines suggest adding a macrolide antibiotic,
Like azithromycin?
like azithromycin, yeah.
I've heard of that one.
Yeah.
That's used for a lot of different infections.
It is. It's very versatile.
Why did they recommend macrolides over other types of antibiotics?
Well, there's growing evidence that they might be better at reducing mortality,
Oh, wow.
which is a big deal, obviously.
Yeah.
But we need more research to confirm this.
So an ongoing debate.
It is.
What about how long to use antibiotics?
These guidelines are moving away from those really long courses we used to use.
Right, like weeks at a time?
Weeks at a time, yeah.
Why the shift?
Well, shorter courses, like 5 to 7 days, seem to be just as effective
Oh, wow.
in most cases.
Okay.
And they have fewer risks,
Makes sense.
like side effects, disrupting the
And
microbiome.
preventing resistance.
Exactly.
Now, what about pneumonia caused by the flu? Does that come up in the guidelines?
It does. They specifically recommend an antiviral drug called oseltamivir for patients with influenza pneumonia.
Oh, okay. Tamiflu.
Tamiflu, yeah.
So if you know it's flu, you hit it with Tamiflu.
Exactly. And it works best when it started early,
Okay.
within 48 hours of symptoms.
What if they can't confirm it's flu right away?
Well, during flu season, if they suspect flu, they might start Tamiflu even before test results are back.
Okay.
It's better to be safe.
That makes sense. Time is of the essence.
Exactly.
What about corticosteroids? They're powerful anti-inflammatories, but I know there's been some debate about them.
Yes, some debate.
What do these guidelines say about that?
They suggest they might be helpful in cases of septic shock,
Okay.
which is when blood pressure drops dangerously low.
So in a really dire situation,
Right, when it's life-threatening.
why would they be helpful in that specific situation?
They can help dampen that overwhelming inflammatory response.
Okay.
They can damage organs.
But the evidence is still mixed.
Yeah, it's still unclear the best dose or how long to use them.
So another tool in the toolbox, but be careful with it.
Exactly.
Now, what about aspiration pneumonia? That's when something goes down the wrong pipe and causes an infection.
Right.
Do these guidelines specifically address that?
They do. It's a common problem. But they recommend treating it the same way as other severe pneumonias,
Okay.
unless the patient has risk factors for anaerobic bacteria.
Anaerobic bacteria, the ones that don't need oxygen.
Exactly.
Okay.
Things like poor dental hygiene can increase that risk.
Oh, wow.
But even then, the evidence for adding specific antibiotics to cover those is weak.
So keep it simple unless there's a reason not to.
Right.
Is there anything else you think is important to highlight?
I think the key takeaway is that these guidelines really push for a personalized and evidence-based approach.
Okay.
It's not just about following a recipe anymore.
Yeah.
It's about using the best evidence for each patient.
It seems like the field of pneumonia management is really advancing.
It really is. It's exciting to see all the progress.
Yeah, it is.
Yeah.
Yeah, it really is amazing how much things change in medicine. I
Yeah.
feel like we're always learning new things.
Absolutely. It's
Yeah.
constantly evolving.
So much new research coming out.
Right. And it's great to see.
Yeah, it makes me hopeful, especially when we're talking about something as serious as pneumonia.
Definitely.
So where do you think things are headed in the future?
Oh, that's a good question.
Any predictions about what pneumonia treatment might look like in a few years?
Well, I think based on what we've talked about today, especially with those rapid diagnostic tools,
Right.
we'll probably see even faster and more sophisticated tests.
Okay.
Maybe even get a complete genetic profile of the bacteria causing pneumonia in minutes.
Oh, wow. That would be incredible.
Like something out of Star Trek.
Right.
Yeah.
And then you could tailor treatment so precisely.
Exactly.
What about new treatments? Are there any promising drugs in the pipeline specifically for pneumonia?
There are some interesting things happening.
Okay.
We're kind of on the cusp of a new era of antibiotics,
Oh, wow.
with new drugs being developed that target those multi-drug resistant bacteria.
That's amazing. So those really tough cases might become less daunting.
Hopefully so.
And beyond antibiotics, are there any other kind of novel therapies being explored?
There's been a lot of talk about immunomodulatory therapies,
Hmm.
which work by boosting the body's own immune response.
Oh, that's interesting.
So instead of just attacking the bacteria directly,
Yeah,
you're giving the immune system a helping hand.
I love that approach.
Yeah, it's a different way of thinking about it.
Yeah.
And of course, we can't forget about prevention.
Oh, of course.
I think we'll see more focus on that through vaccination programs,
Diet.
infection control in hospitals,
Yeah.
and addressing underlying health conditions.
Right, because if you're healthier overall, you're less likely to get it.
Exactly.
Okay, I have one more question for you, a futuristic one.
Okay.
Do you think AI will play a role in managing pneumonia in the future?
Absolutely.
Yeah.
I think AI will be a game changer in all areas of medicine,
Right.
including pneumonia.
Okay.
Imagine AI algorithms predicting who's most at risk,
Yeah.
or helping doctors make real-time decisions about treatment.
Oh, wow, that would be amazing.
So many possibilities.
It's incredible to think about how technology might change things.
It really is.
Well, we've covered a lot today.
Oh, yeah.
From that mysterious cryptogenic organizing pneumonia to the latest guidelines and even a glimpse into the future.
A lot to think about.
So much to think about. I always feel like I learned so much in these deep dives.
Me too.
And I hope everyone listening did too.
Yeah.
It's so important to be informed, to ask the right questions, and to advocate for yourself or your loved ones.
Knowledge is power.
Yes, it is. And as always, thank you for joining us on this deep dive.
It's been a pleasure.
We'll see you next time for another fascinating exploration into the world of medicine.
See you then.